It's not logging.
Yes, Doctor. A very, very good evening, and we see quite a few of you have already logged in. And thank you for joining us again, Dr. Ashutosh.
Yeah, thank you.
Yes,
And good evening.
it is such a pleasure to have you here with us again because I think we met about a month ago, and a lot of our members got back and said that the session was extremely useful. And in fact, they had requested for one another session. So thank you for agreeing to do this with us, Doctor.
And
And
thank you. Thank you for inviting me.
And for those of you who are joining us for the first time, Dr. Ashutosh is a renowned physician with 27 years of post MD work experience at top tertiary care hospitals in Delhi NCR. Currently, he is the director and head of Department of Medicine at Artemis Hospital. Dr. Shukla is also the co-founder and medical director at Prarna Center for Integrative Medicine. He has trained at Stanford Medical School and San Francisco General Hospital for advanced training in infectious diseases. Thank you once again for joining us, Doctor. So we'll straight away go ahead with the questions because, yes, when we met you the last time, we still needed a lot of clarity and we had a lot of questions and we asked you and we got it all clarified.
Right.
But just when we were confident that we got it all clarified, now we have a new set of questions altogether.
Right.
But how is the situation, Doctor? How is the situation outside? Because we have been hearing about the increase in the number of cases in Gurgaon, especially. We've also been seeing the number of death cases going up. But on the positive thing is, we have also been reading news that the recovery rate in India is high. So, what has been your observation, Doctor? How is the scene outside?
So, coronavirus is a infection which is rapidly progressing in the community, and we are in the stage 3 or 4 of the pandemic, and it is rapidly spreading in the community. And right now, we don't have any herd immunity, and we don't have any vaccine. So, till such time, I think the spread will go on, and we need to be extra careful. Luckily, so far, 81% of the patients that we are coming are mild to moderate, 14% are moderately severe, and 5% are critical. So, you have to you have to catch the infection early, nip it there, and prevent complications. That is wisdom, and not to be scared or stay in the fear of the virus, but
Right.
take the scientific steps.
So you mentioned about herd immunity, doctor. So what is this herd immunity? Is it a good thing that we should aim to acquire, or what is it about?
So herd immunity refers to a situation where uh, at least 70 to 90% of the people in the population are protected. Their immunity protects them from virus. So suppose there's 80% herd immunity. So out of 4 out of 5 people will not uh, transmit the infection to others. So the infection gets contained, and herd immunity happens only through 2 ways. One is, when there is a rampant spread of the infection, people automatically develop their immune system, develops the antibodies, or if at least 70 to 90% of the people have been vaccinated. So we are still far away from that stage, and we have to take the other steps to till such time that the herd immunity is reached.
Okay. So we do keep reading about, because in the community we keep reading about posts where uh, people have been turned away because of the non-availability of beds and things like that. Uh, I was also just wondering, because we have been seeing a lot of communication in the in the communities about how the RWAs and condominiums can organize themselves so they can prepare themselves as a facility. So, how do you think RWAs and condos can help in this situation, can support their residents in this situation, Doctor?
So what I feel is that there needs to be a periodical review, education of the staff of the RWAs on preventive measures and the correct way of checking. I mean, while I was coming back from the hospital, the guard at the condominium entrance stopped me and checked my temperature with that laser gun. And I asked him, what is my temperature? He says 88. So he doesn't know what is the normal temperature. And probably that gun is also not recording the temperature correctly.
Right.
All these things, plus, many times I see these people, wearing a mask in the incorrect way. The nose is exposed, only the mouth is covered, and people are crowding around, not maintaining physical and social distance. So these are the issues which need to be percolated down to the lowest possible level, and all this needs regular education sessions, training sessions. So even though I check these guys off and on, but there needs to be a concerted effort on that front. uh, Plus, I mean, going forwards, how this pandemic evolves, maybe, if the infection is spreading too rapidly, then maybe the RWAs need to have a different level of strategy and planning, maybe some community room or a club room to, keep the people who are infected. So maybe it needs a lot of thinking and planning, which needs to be done, because
So I do see a lot of conversations on Facebook where people have already initiated the talk of maybe procuring the cylinders and probably having an oximeter and also having some temporary beds out there in the common facility, and also kind of have a tie up with one of the hospitals so that they can support the residents better. So this was one conversation which I found it interesting, because it is also a way to prepare. Now, in case this goes out of hand and in case people are running out of bed, then this can be a great idea as well. But I wanted your thoughts and inputs on that as well.
So we have to go by the pattern, the way the disease evolves. I mean, it starts as a mild illness, and initial 1 week it's a mild illness. Uh, 81% of the cases resolve after a week or 2 weeks, but the moderate or the critical illnesses, that the 14% and the 5%, they take about 3 to 6 weeks to recover, and some of them may have complications. So that fraction is smaller. So we have to focus on both the fronts. I mean, domestic care, uh, isolation in the home for people who have mild or moderate illness, and hospital care for people who have critical illness or severe illness. So on two fronts, we'll have to address these issues.
Right. And we also keep receiving a lot of queries for plasma therapy, doctor. So, what exactly is this plasma therapy, and how easy or difficult this entire process is? Because we have there is a lot of requirement, and we hear that there are not enough people coming forward, or probably the information that I have received is wrong. But please pitch in, doctor.
So, plasma therapy is something which we do in only those few cases who have critical illness, who have adult respiratory distress syndrome or a very severe kind of illness, those 5% or 10% of COVID patients, where other modes of treatment are not working or are unlikely to work. And this is known as convalescent plasma transfusion. What happens is those patients of COVID-19 who have recovered from the illness, from them we take out the plasma. Plasma means that portion of the blood which doesn't have red blood cells, white blood cells, and platelets. So you take out the plasma. This plasma of the patient who has recovered from COVID-19 has antibodies in it, and you transfuse this into a active COVID-19 patient. So he gets some protection, and these antibodies kill the virus, and the patient recovers. But there are certain criterias there, in the sense that it should be done at least 2 to 3 weeks after recovery from a convalescent patient. And the plasma should be screened for diseases like hepatitis B, HIV, and malaria, etc., because these can be transmitted through the plasma, and allergic reactions. So it should be matched. Group matching and all. So these are the precautions, but it is effective and it works in these critical patients.
Got it. There's a question from one of our members. Is one blood group more or less susceptible to the infection?
Yes, there was a study from China and then another study from New York, which said that people with blood group A are more susceptible to COVID-19 and people with blood group O are less susceptible to COVID-19. But these are, off in between studies, and scientifically, the paper was not very strong in the sense it was not double-blind control trial. It was not a very good study. In the last 2-3 months, uh, there is a huge amount of scientific data which is churning out, and we have to be very selective and choosy of which scientific study to digest and which to listen to, which not to listen to. So, I mean, I would park this study aside.
Okay. Uh, Now, next there is a question from DT Kaushal who asks, is there a way to differentiate between seasonal cold and cough and COVID-19? With cold and cough, after how many days should one go for a COVID test?
So, seasonal cold and flu vis-a-vis COVID-19, they mimic each other so closely in the initial stages. Um, Seasonal cold and flu will have more of runny nose, whereas COVID-19 will have more of cough. But in the current situation where we are in pandemic stage 3 and 4, I don't think we should waste time. We should immediately talk to a doctor or your physician, at least get the initial blood test done. I mean, a complete hemogram, maybe a C-reactive protein or a LDH or liver enzymes, which are raised in COVID-19, which are not so raised in seasonal cold and flu. It will help us differentiate. So, in my experience over the last 2-3 months, I found people, trying to be in the denial stage. They feel that no, this is a cold and cough which I get every year, and maybe this will just pass off. And in that process, they waste precious time.
Right.
What I suggest is that be on the lookout, get talk to your doctor early, get the blood test done. If there is a suspicion of COVID-19, then get a throat swab done. If you prove it, then you start the treatment early. So chances of complications are less.
So what about the oxymeter, doctor? Everybody's been now that's doing the next round, saying that we should have an oximeter, and if we see that the levels are dipping, then we should immediately go out for a test. What is your take on that, doctor?
So this is a very simple device. It's a battery operated thing which is clipped onto your finger, and from the nail bed, it reads the level of oxygen in your blood. And it's a very helpful device in COVID-19. Uh, I recommend it for all my patients in home therapy because it gives me a early warning sign where oxygen starts dipping and I need to intervene and I need to get him to the hospital, or if I need to get an X-ray done early. So it's a very helpful thing. I think people who are diagnosed with COVID-19 should, in the early stage, get this equipment with them.
Okay, so in fact, what the WhatsApp messages or whatever the information in circulation is that uh, whether you have it or not, or whether it is just safe to keep it at home, because then you can always test it and know whether your levels are dipping. That again brings, I think I'll tie it down to the next question. What exactly is asymptomatic, doctor? And if they are asymptomatic, what actually motivates them to go for the test? That is one. And after claiming asymptomatic transmission of COVID-19 is rare, WHO has now clarified that it does happen. So, how does one without symptoms even transmit the disease, and why is this important in containment strategies? One of the questions on this has also come from our member Upasna. So, yes, doctor.
So, asymptomatic infection does happen in COVID-19, and it was one-off report from WHO. Doesn't happen, but they withdrew that report. What it means is that a person who is not having any symptoms at all, he is spreading the virus to others without even knowing and realizing that he is doing so.
Okay.
There are three types of such infections. One is asymptomatic, means he will never get symptoms in the future, and he'll just be spreading the infection. One is pre-symptomatic, means before he gets COVID-19, for incubates, he is actively spreading infection to others. The
Okay.
third category is post-symptomatic, means he'll have mild infection and it will go away. His immunity will counter the infection. So that's why it is important to strictly maintain all the precautions which have been recommended by WHO and Ministry of Health.
Right. So, but in an asymptomatic case, a person is neither coughing nor sneezing also, right? And then how does still a person transmit?
Yeah, so because when he's talking or when he is
Right.
speaking, there are some tiny droplets which are released. Even when he coughs a little bit, these droplets are carrying the virus. And there was a study in Nature magazine which said that out of the total infection, 25 to 45% of people are asymptomatic. So it's a huge load which we don't realize.
Hmm.
I mean, so we have to be mindful of that and take all the precautions.
So, are the asymptomatic cases actually, does it mean the immunity is better, doctor? Or,
Yeah. In any infection of a virus, there are two factors which determine whether you get an illness or not. One is the amount of viral load which enters your body. The other is your innate immunity, the ability to fight the infection. So it's a complex interplay between these two factors. And some people get a mild illness. I mean, I have so many families, two people in the same family have active COVID-19, the other four don't have. So why is that so? Because of their immunity.
okay, yeah. There is a question from a member. Bhavna Bhatia is asking, have we seen cases where there is no fever but other symptoms?
Yes, there are patients who have fever, but they don't have the typical, all the five, six category of symptoms. I mean, people don't have metallic taste, they don't have loss of taste, smell, they don't have, they may have little bit of cough. So we have to have a high index of suspicion. There may be a mild symptom of body aches, generalized malaise, etc. So you have to be watchful and on the alert.
Chitra Sharma asks, is it possible for a person or family to get infected without going out since lockdown one started? And and if it is possible, then how or why?
So if you are not going out at all, you need to be watchful of if there is somebody, if you're a maid or you're helping people or driver or somebody is coming into your household, whether they are carrying infection inside. So there are so many factors. I mean, but staying indoors is always helpful. It mitigates infection. It curtails spread of infection.
Shweta has a question. I think this is on all our minds. Is eating raw vegetables and fruits like cherries, jamuns, cucumbers, which we can't peel off, fine, or should we avoid it?
So what I would suggest is when you get these fruits and vegetables, dip them into a solution of 1:4 ratio of white vinegar and water, and just let it be for 10, 15, 20 minutes and just wash it off and then wash it with cool water and then you're fine, you're safe. Or if you can't do this, then maybe dip it in some water and add some baking soda, so that should be fine. And if you wash it thoroughly, you're good to go.
Okay. Uh, can you tell us more about happy hypoxia associated with COVID-19? This is a question from Shobna.
So she must be referring to hypoxia. Hypoxia is when there is desaturation, means the level of oxygen in the bloodstreams falls to less than 94% through the pulse oximeter. Uh, so, uh, that typically happens because the COVID-19 virus infects our lungs first, and uh, it forms a pneumonia, typically both lungs, in mostly in the lower side zones, and because of poor transmission of oxygen, the levels of oxygen in the blood fall. So that's what is known as hypoxia.
Okay. Again, a question about immunity. This is a question from Suja. we now are aware that improving our immunity may be the one way forward against this virus. So, what natural food would you suggest to include in our daily diet? Would you suggest supplements that can be equally helpful? Please suggest the same.
Yeah, so in current times, I think immunity is a very important thing to uh, enhance and boost. And immunity is something which is uh, innate in us, and it's like there are different cells, organs, and structures which work in an orchestrated fashion, and they fight the infection. But unfortunately, there's no such magic pill that you take overnight and your immunity gets boosted. Uh, um, I mean, immunity is determined by various factors. It is genetically determined, but there are twin studies which have been done, which have shown that uh, identical twins also didn't have the same kind of immunity. It was determined by the kind of exposure to the infections they had throughout their life. Plus, it was also determined by their lifestyle. People who have, been leading healthy lifestyle, they have a very strong immunity. Uh, a good, nutritious, balanced diet, regular exercise, doing some yoga on a regular basis, taking care of your emotional health. If you are stressed out, you tend to have lesser immunity. Your sleep also determines your immunity, because during the sleeping hours, the brain and the body does some restorative functions. So if you get a sound, uninterrupted 7-8 hours of sleep, that boosts your immunity. So it's a multifactorial. Of course, in Ayurveda they say that Chyawanprash, 1 teaspoon once a day, uh, boosts your immunity. Then they also say that haldi doodh, one glass of milk with half a teaspoon of chota wala chammach with haldi with twice a day. That also boosts your immunity. But the thing is that one should not have water immediately after Chyawanprash. You can have the haldi milk after the Chyawanprash. So these are the various ways by which you can boost your immunity, but it doesn't have happen overnight. I mean, it has to be a sustained effort which has to go on, and that's how your immunity develops by leading a healthy lifestyle, by doing all these things. There are various, over-the-counter things which are available, from ginseng to ginkgo biloba, etc. But the trials are limited and they're not very convincing enough. So I would focus more on these things which are proven.
I think you answered this question. You did answer this question during our last conversation as well. But since it's come up as a question, we'll just probably touch upon it briefly. They say this is again a question from Bhavna who asks. They say one should take a lot of steam and keep sipping hot water. Does this really keep helping in keeping corona at bay?
Steam inhalation uh, does help to moist our airways, and generally the viral infections, any infection tends to be at bay. And having lukewarm body temperature or little warm water does help. Even in our traditional Ayurvedic sciences, also it has been recommended. So I would recommend that.
Okay. Yesterday's headline read India's COVID 19 recovery rate climbs over 52%, and the rate of cure in India is higher than most other countries. So, which type of drug or particular regime has proved to be more effective than others in a large number of cases in India, Doctor? What has been helpful for us?
So I feel that we have we went in for an early lockdown, and that helped. And in fact, you'll be surprised to know that uh, so far in India, 180,000 people have recovered from COVID-19. Uh, and plus, the right treatment at an early stage, frequent and a lot of testing at an early stage. Throat swab testing should be done more frequently, more numbers to identify as many COVID-19 patients at an early stage. So these are the strategies which help to have a better cure rate. And the drugs that which we are using for treating patients, for mild to moderate patients, mostly hydroxychloroquine, azithromycin, ivermectin, but depending on what is the situation of the patient. For the more serious ones, we use tocilizumab if we are suspecting a immune disturbance, or if there's a severe illness, then maybe convalescent plasma therapy. Even recently, as of yesterday, there was a study from Oxford which said that dexamethasone steroid does help in very severe or critical patients. We have been using solumedrol, a sister compound of dexamethasone, but uh, those scientists have used dexamethasone, and they say that they proved it that it helped in severe critical illness.
Uh, okay, so we do see the number of cases are only going up, um, but we also keep reading that leaders are assuring us that community spread has still not started. But again, we also keep hearing of cases from the neighborhood where people have said they've never stepped out of the house, they've always been inside, and they still have got it at some point. Probably they received deliveries, etc. So, doctor, in what phase are we right now? Um,
So definitely, we are in the stage 3 of the pandemic, and there is a community spread which is happening, um, and that's why the numbers are rapidly going up. Um so at this stage, it's critically important to be practicing all the hygienic measures and taking all the stringent precautions as much as we can.
right. Do you recommend any home emergency kit for this period?
Yes, one should have at least the basic thermometer, maybe that pulse oximeter which you were talking about. Then medicines, basic paracetamol, multivitamin B complex, zinc, something B complex with a zinc, maybe vitamin C. These are the medicines which are generally started in most COVID patients at the early stage. So it'll be helpful to have that.
Right. Thank you, doctor. And right now, we are also seeing a lot of people having the need to travel, need to fly. What are the necessary precautions one must take before they decide to fly?
Yeah, so one should travel only if it is essential. Non-essential travel should be avoided as far as possible. But if you have to travel, then you ensure that whatever things you are taken with you are sanitized beforehand. You wear a face mask with the proper technique, and you carry with you yourself um, hand sanitizer, the wipes which are used to sanitize surrounding surfaces, and avoid touching too many surfaces in the cab which you are taking to reach the airport. And at the airport, maintain a physical distance of at least 3 to 6 feet away from others. And the face mask which you wear, if it gets moist after 5 hours uh, or 6 hours, it should be replaced with a fresh face mask. And one should wear it completely, covering both the nose and the mouth, and holding the face mask with the tags. And fidgeting with the face mask is not the right thing, because you're carrying the infection from there onto your fingers.
Mm.
And uh, taking all the necessary, and wipe with you, those Clorox wipes or the and sanitization wipes you can use to clean the surrounding area wherever you are sitting. So there are standard precautions which one should take if you have to fly.
Definitely, yeah. So we've also had a few logistics question in the community. One question that we get asked very often is, uh, okay, if I have a cold or something, then what is the logical next step that I should do? Should I be waiting, or immediately should I inform my doctor? what should be the next steps, and when actually does it require for me to call up a medical professional or to call up a doctor? When does it actually require for me to go for a test? So if you could just walk us through that, that will be helpful.
So, I mean, if you get fever with cough or sore throat, uh, what I feel is you should contact your physician as early as possible. And let's not wait assuming that it is a seasonal cold and cough,
Hmm.
because you never know what turn it may take. And
Many of them who have messaged have asked without fever, but if they have cold and sore throat, then should they still be worried? Is that a stage to worry at, or should they wait?
uh, they should talk to their doctor first. The doctor will be able to differentiate at that stage where the thing is heading. And if possible, a simple blood test like a hemogram,
Hmm.
uh, if the ESR is elevated or if the lymphocyte count is low, that helps you say that, okay, this is COVID-19, it is not seasonal flu or a cold and cough
Okay.
routine. If you can get a LDH done or liver enzymes if they are elevated. So these are small indicators at a very early stage through a blood test, which can help you differentiate whether it's a ominous thing or it's a minor issue.
So are these tests like routine tests? Does this require a doctor prescription?
It does require a doctor prescription, but it's always best to even have a teleconsult with your doctor and talk to him, and at least have somebody in the loop instead of taking self medication and taking the decisions yourself.
That is true. Yes. Another question is, if a patient is non-COVID but has an emergency, where can they be rushed to?
So I mean, if there's a non-COVID patient and there's an emergency, uh, avoid self-medication. Don't be scared of taking the patient to the hospital. Uh, Talk to your doctor on the phone. Let him take a decision whether you need to rush the patient to the hospital. And if you go to the hospital, take all the precautions and go to the hospital wearing a face mask, gloves, etc. Because in the last 2 3 months, about 50% of patients have avoided going to hospital, and morbidity and mortality in the non-COVID patients has gone up tremendously, which is really a sad thing because people are scared of catching the coronavirus in the hospitals. But what I feel is if there's a need, one should go to the hospital because we don't want non-COVID patients to be suffering.
True. Now, again, there's a question about asymptomatic case. So Astuti has asked, how do I know if I'm asymptomatic if I'm not showing any regular symptoms?
So there's no way of other than getting a throat swab test. There's no other way to detect if you and throat swab test you do only if you have had exposure to a positive case, confirmed positive case, symptomatic confirmed case. So you can't do throat swab test for everybody.
True. Parul has asked, are private hospitals taking COVID patients? Can you name few? They are. I think we can share the list later, or would you like to take
So
answer?
now the mandate by the government is that all private hospitals have to take COVID patients, and a certain percentage of the beds has been designated for COVID. So uh, it's pan Gurgaon.
And again, this is about community spread. Is COVID only through breathing or surface spread equally dangerous? We all sanitize daily things like all our veggies, groceries, etc. So, is there an equal risk with such things as well? This question is from Mona.
Yeah, so the infection risk is with both. When a person with COVID coughs and sneezes, he spreads the infection. Surface things are also spreading, but recently there was a study which said that it is more to do with the direct spread from coughing and sneezing by a COVID patient, and through surface things, it is less compared to what it happens through uh, coughing and sneezing.
Subhashni asks, if anyone in family is COVID positive, what are the precautions others should take while taking care of the patient at home in case the symptoms are mild?
Yeah. So if the patient has mild or moderate COVID, he should be isolated to protect him from protect all the other members in the family. He should have be in a separate room and preferably with a separate washroom. His clothes should be separate. His towel, utensils, everything should be separate, and a strict sanitization of all surfaces which are frequently touched, like door handles, etc. With a solution. You have to prepare the solution using 7 grams of bleaching powder in 1 liter of water, and just spray it on a tissue paper and just wipe all these surfaces and maintain this. Once you prepare the solution, this solution is good for 24 hours. After 24 hours, it is ineffective. So one is, sanitization, isolation. Then people who are giving food or going to this patient, they should maintain a distance of at least 3 feet. And the room in which this patient stays should be ventilated, in the sense once or twice in a day, the windows should be open so that the air can cross through, and all hygienic standards are maintained, and a regular consultation with a doctor to monitor his vitals, his pulse oximeter, oxygen saturation, regular medication, blood tests. So, and a watch on other members in the family. If they develop any symptoms, they should also be checked by the doctor.
Does UV sanitization of vegetables and fruits, is that advisable?
So vegetables and fruit should be, just once you get them from outside, they should be cleaned thoroughly. And like I said, either in baking soda or in a solution which is 1:4 white vinegar and water.
Okay. Another question is COVID also waterborne? Can it be transferred by water? And should RO water be heated again? Should bottled water be heated again?
No, this is a myth. COVID is transmitted only through respiratory droplets.
Okay.
It is not transmitted through water.
Okay. What if the respiratory droplets fall in water? Then can it survive there in water?
Water, it gets washed off, but if it falls on hard surfaces, it stays there for some time.
Okay.
So depending upon what surface.
Okay. So the past few days, we have been seeing a lot of updates on vaccine and giving us, it does look hopeful. So
Yes.
when is this all going to end? And okay, the first question will be, will the curve flatten in India? When is it expected to flatten in India? The second is, when can we expect a vaccine?
So there are 100 companies which are actively involved in manufacturing of the vaccine, and it's a very complex process of making a vaccine, because there are two major things which one has to take care of. One is the safety of the vaccine, and the other is the efficacy. Means it should be effective enough to protect you from the disease, and it should be safe. It shouldn't cause any harm. So that's why this entire process takes so much time, and hence we are still waiting. And out of the 100 companies, there are 14 companies which have done remarkably good in the development, and out of that, 7 have started human trials as well. So there's a collaboration between Oxford University and Plasma Institute in Pune, which have done major strides. Then there's another collaboration between biotech and another company in Philadelphia, where they say that by September, October, they should be ready with the initial vaccine. This was quoted by our ex-ICMR director, N.K. Ganguly, yesterday only in the newspaper. And hopefully, but mass manufacturing and all for the entire population will probably happen by Jan or February 2021.
Wow. But at least, okay, there is some light at the end of the tunnel.
So till such time, I think all of us will have to do all the basic precautions, face mask, hand hygiene, not touching the face, so social distancing.
Right. So thank you so much, Doctor, for patiently answering our queries. Now, before we wind up, is there any thoughts that you would want to leave with our guests today?
Yeah, so this particular coronavirus is difficult to contain, and evidence suggests that people without symptoms can spread it. Hence, you have to be extra cautious and careful, and just follow these 5 or 6 standard precautions which have been recommended time and again by WHO and all Ministry of Health. So it's not only we as a community, but we have to make sure that others in our in our community, the people whom we meet, they follow all the guidelines laid down, and hence we'll be able to flatten the curve, and the infection will not spread so much, because ideally the lockdown should have been extended, but because of economic reasons, you can't stretch the lockdown further. So now it's in our hands to take all the precautions.
Definitely, definitely. Thank you so much, Doctor, for emphasizing on that. It was great to have you here with us and answer all our questions. Thank you once again.
Thank you, Neela. Thank you for inviting me, and stay safe and stay healthy. Wish you all the best.
Thank you.
Thank you. Bye bye.